I think the engineering technology program is very hands-on. I think most of our technical classes do have lab components. And so students are either, working on the computer, doing drafting, modeling projects, in the Idea Lab, which is like a fab lab, making prototypes, using tools, CNC machines, robots, things like that. So I think that we certainly have a strong hands-on component in our program, and I think the students appreciate that and do well with that. I think it's something that our local employers are looking for, or students with good hands-on capability. We've even just recently developed a class for that teaches students how to use hand tools, something that you know years ago students would just know how to do from hanging out in the garage or from their family, and so many students today just don't have that hands-on experience. So that's something that we focus on in the program. We have our theory, we have our science classes and applied theory classes, but the hands-on component is really a big key component of what we do.
So, how I try to bring active learning or applied learning into the classroom, probably the best example would be just using case studies, learning through case studies, giving students real world problems, stuff that they might encounter in the real world, and then setting them to the task of trying to solve that problem using the concepts that they're learning in the class. A lot of students report having issues with anxiety or depression, and so taking information that they might be learning in a segment on abnormal psychology and having them apply that to, if you had this particular person with these symptoms or challenges that they're experiencing, what sort of things could you do or could that individual do to help them alleviate the symptoms that they're experiencing?
In our economics courses recently, we've talked a lot about inflation, and we have asked the students to look at how inflation is discussed in the media because it is a very large media topic right now. And then we bring those back into the classroom and break them down, and then we talk about what really causes inflation and what we can do about it. So they can see, the knowledge that they need to know, but also how that is sometimes expressed in the world, and really to learn how to take in information from the world, that financial and economic information, and then use it appropriately. We also do a unit in difficult conversations that's across some of our courses. And so, for example, in one course, there's a scenario where one of the people has to fire the other person because of something that has been done, and they have to practice, how to do that appropriately, and then they watch other people do it, and sometimes it's really difficult, and sometimes they can't stop laughing and get into the role that they need to be in. But, if you've ever been in a position of doing that, it is uncomfortable. So we want them to practice that. We also have some really good simulations that we use that help students recognize what the workplace might actually be like and what kind of decisions they'll actually have to make.
Anyway, there's a mannequin that can pretend that they're having a cardiac arrest, hyperventilation, and other emergency situations that the students have to figure out how to get this patient back to homeostasis. Also, we partner with local clinics, and one of our favorite places to go is where they build prosthetics. And so they get to go over there and watch them build the prosthetic and treat the patients, or watch them treat the patients that have the amputations. Between all three faculty that teach in the program, we have lots of connections with patients that we used to treat. Burns, strokes. I had parents that both had a stroke, and we would bring them in so that they can see what it feels like to have high tone or have flaccidity. You can't show them that in the classroom. So when we have people that are willing to come be authentic and transparent with their diagnoses, a spinal cord patient, there was a young lady who had a very bad accident 3 years ago, and she's now a quad their age. And she comes in and shows them, she works, she trains for the Special Olympics. She's back in high school driving a car. So these real life people that can come in and show the students and also let them touch and feel the residual limb that just was amputated gives them less of a shocker facial expression and an experience when they go into the real world. We have a fundraising opportunity for our students to offer a spa day for all the faculty and students on campus. And they give massages and paraffin dips and hot packs to anyone that comes and donates to the students. It helps pay for their licensure exams that are pretty hefty. But they do that every spring for their service to the community. We also, in lab, we had students go around in wheelchairs recently, and they make a list of things that are not well for the college. And we generate this list and we just send it on. If they're in a wheelchair, what places was really hard to get in, what things can be improved in the bookstore, in the cafeteria while they're in wheelchairs, or if they have visual deficits, I put glasses on them where they can't really see and they can't feel. And we make this list, and it really opens their eyes to the disabilities that they might have to help someone treat and overcome when they go home.